So this may be some kind of first. It's about endoscopic management of nutritional problems, and it's about addressing nutritional challenges with precision endoscopic expertise. And so what do we hope to achieve in this session? We're going to shorten it a bit because we're running behind on the stream. It's so to understand the clinical indications and benefits of enteral and parenteral feeding. This can be very quick. Learn about different feeding options and how to choose the best method for patients for feeding. Gain insights into the technical process of PEG placement and learn some practical solutions for overcoming technical difficulties in PEG placement. According to the study by Kucha P. et al., UEG Journal 2023, what was the overall percentage of adverse events after insertion of a PEG tube using the push technique? Maybe you don't know what the push technique is, but anyway, here's the quiz question. First person to get the correct answer, this clock has already started, so maybe someone's already won, gets 10 GIEQs coins.
This gentleman has got a head and neck tumor, and they want us to do a push PEG tube, which I hadn't even seen until lunchtime today, but I've got Tamash with me. And the reason he's a googly is because he has, when we unveiled the patient, he has a huge midline incision, and he's had an epithelial.
So, what's not the purpose of this talk is to talk to you about specific indications and contraindications of artificial nutrition or how to prescribe it. What is the point of this talk is to understand really only one thing, and that is parenteral nutrition is dangerous, and if you can use enteral nutrition, do it. Okay? And that is the point. So, when should you start? Well, we know that these are some of the indications which we use to start artificial nutrition. Two settings, acute and chronic. When do you use EN, enteral nutrition? When do you use PN, parenteral nutrition? In the acute situation, you can use either. And I think it's fair to say that the majority of the adverse events associated with parenteral nutrition occur in the chronic situation, not the acute situation. There are less infectious complications for enteral nutrition, less post-operative complications for enteral nutrition, less blood glucose fluctuations, and shorter hospital stay for enteral nutrition with a significant excess cost. And I think everybody understands that there is an excess cost of parenteral nutrition versus enteral nutrition in the acute situation. Do not use TPN if you can use enteral nutrition. And then also, it's very important because you very, very commonly see people trying for an enteral feeding route, maybe not being successful, and then just falling back on TPN. We certainly see that in Belgium. I've seen that in Belgium a lot more than I've seen it in the other countries that I've worked in. So if it is in your country, common practice, because it is available, just to rely on TPN, try to educate those around you that it's maybe not a great idea because of these reasons.